Yeah, her whole purpose was trying to identify what's the formula that makes people happy. What is there a pattern to it? Is it a common thing among us all? And then how do you back up from there? Being social was one of those things, for sure. But I like Slick Rick's definition. It takes out all the technology and all that.
Yeah, yeah.
It's not just about can you do big data. How are you using that to make things better for the.
Okay, time to move on. I can't believe it. We're actually going to cover most of the material. So hey, this was interesting here. This I got off of a website called the Community of Transportation Professionals. All right, and they talk about transportation's role in public health, and they actually mention Smart Columbus. And so about 2 years ago, a year and a half ago, Columbus was among 70 cities that applied for $50 million in grants to develop smart city transportation stuff, and then use that. So instead of giving 50 cities $1 million apiece, they said, well, okay, we're going to give 50 million to one city, and it's really going to do a good job, and then we'll copy that model. And so down here it says, for one example, the Smart Columbus project in Columbus, Ohio, intends to leverage smart mobility solutions to reduce the city's infant mortality rate by 40% and cut the health disparity gap in half. And Columbus is looking to achieve these goals through the development of a multimodal, that means buses, cars, bikes, walking, Lyft, Uber, trip planning applications. So basically they're working on trip planning that is end-to-end, crosses all the ways in which you can transport yourself, including, so basically the biggest success they're aiming for is to basically wrap Lyft and Uber and the bus system together into a seamless sort of workflow, and you pay once, okay, for the entire flow. And they have a smart payment system, and we're going to find out a little bit more about that because we're actually going to look at a vendor that won the contract. There's an article down there, but I want to at this point. In your towns, I think Dalton is near Atlanta. You've got Phoenix. Daniel, you're down in Florida, if I recall, right? Okay. And Slick Rick, and you got a new person here. Hey, Manish, how you doing? Hey, Manish, come up here. I want to introduce you to people. Come up this way. Okay. So I just want to say a shout out to a couple of regulars. Okay. You've met the guy in green. That's Dalton over here. He's been to a bunch of these health systems chats. There's every other week for an hour. Just go to the website, go up to channels, and then you'll see health systems chat, and you can subscribe. And Manish has attended all the way from India, where it's like, I don't know, midnight or something there. Yeah. And Manish is, in fact, we're going to see in a moment here. I'm going to, at the very end, in about 10 minutes, Manish and Dalton, I have your pictures over here on the corner of the smarttoon city. Anyway, but we're going to introduce you in a bit when you're standing next to your picture, Manish. So I'm going to continue my thinking here. Okay. And I'm sorry, I'm getting very confused. Anybody here have some interesting transportation options in their cities that, it may just be a headline or a particular experience you've had, or it could be a frustration that relates to the overall theme here of either smart cities or smart health? Well, okay, I'll let you off this time. All right. Technology. Now, Slick Rick gave a good, and Nico pointed out, that it didn't emphasize the technology. Well, now we're going to emphasize the technology. So here we have the Smart Columbus operating system, a web-based dynamic governed data delivery platform on a federated architecture that is at the heart of the Smart Columbus system. It will ingest and disseminate data while providing access to data services from multiple sources and tenants. Oh, what's a tenant? Oh my gosh. I don't think it means human people who are in a tenant building. I think he means something else, including the planned Smart Columbus technologies, traditional transportation data, and data from other partners such as food pantries and medical services. Dalton, what's going on there? Can you explain that, some of those words to us? What do you think is going on in that paragraph? Top paragraph.
Which word specifically?
Right here, it says web-based dynamic governed data delivery platform on a federated architecture that is at the heart of the system. It will ingest and disseminate data while providing data services from multiple source and tenants, including planned Smart Columbus technologies, transportation data, and data from other partners such as food pantries and medical services. There's some buzzwords in there. Can you kind of explain what's going on?
Yeah, there's a lot there. That's one of the things. You look at all of those different things, and there are technologies for that. Trying to figure out who needs the food, who needs the transportation, what is the relationship between those things. The fact that they're tying food pantries and medical services. There's a lot of talk these days about physicians prescribing food as the medical treatment, as you'll see in a second. One of the things is prenatal advice. Those things tie together. If you can't get to your doctor's appointment, you can't get the treatment that you need. If you don't have access to healthy food, we got to get that healthy food to you so that you're not walking next door to McDonald's every day. But trying to find all those relationships and tying those things together, that's the complicated piece of what's the easiest and best way to do that, and obviously with speed.
Super. Well, thank you. Anybody have any questions for Dalton? All right. Okay, right here, I'm going to skip. By the way, this list here, this colorful list, I won't read them all out, are kind of like the 8 projects, okay? But this one down here is what this article is about. And because I wanted to drill down into specifics, and it is, we're proposing a system to easily provide flexible, reliable two-way transportation for expectant mothers using Medicaid brokered transportation services. And so let's go over here. So that relates to this. And so I just, when I started out, we went to the wiki page for smart cities, and it started kind of abstract. And then over here, we looked at this giant diagram, and it was very listy, and so we're trying to come up with, descriptions that are kind of, and I thought, well, maybe what we need to do is really drill down and look at something really, really specific. And so I thought this was interesting because it's about this lady who founded a company for about transportation technology to improve health, and she won a $1 million contract in December from the city of Columbus. And over here, it's at the bottom, she's quoted as saying, "I never wanted a project more than this one," Kniebel said. "It killed me that pregnant moms can't get the care they need, and it's something simple and solvable." All right. So now you've got the personal passion. You've got a face there to personalize things. And she founded her company to facilitate non-emergency medical transportation after dealing with frustrations in her family. And she talks about her aunt with multiple sclerosis and breast cancer. And then she says, transportation is a social determinant of health, but it's spread through so many other determinants. Interesting. It's food. Okay, transportation to the grocery store, transportation to, to your checkup. And then it says she closed a $3.8 million financing round, and she's working with the local Ohio State. And then down here in smaller font, she says there's plenty of vehicles out there. It's really lack of access to them. So that sounds like almost like Uber and Lyft. And we need to meet people where they are in the preferred mode of communication, the preferred location. So now we're talking about, connecting communities. And here we have, she won the contract over 5 other companies, including 3 local companies. So it's interesting that someone from outside of Columbus, that is from Chicago, won over the local folks, which I actually, I'm always rooting for the local team but I'm impressed because it meant that I think that it wasn't just, pulling strings,
Hello?
hello. Unfortunately, you have to go. I'm so sorry. Anyway, I wanted to put that there because I think it's a kind of I used to belong to a poetry group, and the guy talked about the reflection. The universe is reflected in a puddle. So you look in the puddle and you see specific rocks and specific ripples and a specific reflection, and yet it's universal. Well, it's interesting when I look at this is like a puddle, and it is full of specifics, but I think it reflects some larger themes and ideals and goals of the smart city, smart healthcare connection. And anybody want to jump in with a thought, a comment?
Yeah, this is just, this gives me chills because this is exactly what we're talking about. You brought up something interesting about the transport. Like, it's more about how we make decisions and how we make political choices, how we vote, how we prioritize what the data tells us we need to be doing. Because, you said Uber. What's interesting about Uber is if you think about it, like outside of this is a massive business or whatever, people could pay different rates. Uber could be the largest public transportation network, in the country, if everything in Uber maybe was subsidized by some form of government intervention. So you'd pay lower rates if you were of a different earning income class or something like that. And so you can actually, like what this young lady is doing here is exactly that. She's commandeering these networks to kind of create equality. So I think it's just amazing, but it's about how we make these choices because we're funding companies, but it maybe takes too long, or maybe there's not enough of a system-wide approach. I don't know.
Yeah.
But sorry, I'm rambling, but I think that's something else.
That's so good. No, I thought that was a great mental dump. Anybody else want to weigh in?
That's great. Yeah, I'm going to just piggyback onto what you said in terms of non-emergency services. We see hospitals and we think of those as our health care. That's really the sickness care. And what she's trying to address is that you have needs to stay healthy and avoid the sickness. You want to take care of these expecting mothers and their infants before there's mortality problems. And there's defects because the poor babies could never get food. So she's truly addressing health rather than just thinking, how do I get somebody to the hospital?
That's great. Great. Okay, we have got about 8 minutes left. I can't believe we've actually covered almost everything. But let's everybody come over in this corner. Follow me. And because I want to get a couple of selfies. These are for a couple of regulars, specifically Dalton and Manish. Come over here. Manish, I know you may be streaming video, but you're going to have to come over here anyway, because you can't video yourself. And I want you to stand. In fact, actually you can, because you get your picture right here. So now turn around and face the sun. See the sun that's floating up there? Okay. And now kind of turn in between, face a little bit toward me. Look halfway between the sun and me. There we go. There we go. Okay. Now we're going to get the selfie. And 3, 2, 1. Let's let's look at it. Okay, I need to, you stay where you are, and I need to do it again and capture more. 3, 2, 1. Okay, we're going to do it again. 3, 1. Ha! I'm completely blocking you. Stay where you are. No, you move to your. Oh, well, I'm gonna move over here, and one more time, and then I want to get Dalton. 1, 3, 2, 1. Oh, perfect. Okay, so now I apologize to the other folks.
Can I ask you a question?
Yes, go ahead. Please go ahead. But Dalton, come over here. Go ahead. Keep going. Keep asking.
You know about sustainable development and smart cities, right?
Huh?
Do you think that like a lot of these cities are actually not necessarily doing this to the democratic process, but more in committee? A lot of these more environmentalist agendas are kind of getting pushed through committee rather than going through a democratic process. Do you think that some of these being imposed on the citizenry is more,
okay,
Okay.
This is great, Daniel. You, what a great place to end, because you hit something. This is pretty dense going, but and I've seen this elsewhere, and that is. And I didn't post the article, but I want to use it was one. So you've heard smart city. Well, I came across this article about what's called legible cities. So legible cities, and it starts off by saying that in the opinion of the author of this editorial kind of opinion piece, that some smart cities are what you say. I mean, they're sort of top-down design, and they're not honoring, except maybe through lip service, the need to more organically bottom up drive, the smart city phenomena. Okay. Now over in the Columbus smart city area, in 2 or 3 of the articles, it mentions right at the bottom, it says, oh, there was a webinar given that citizens were invited to. Okay. That I think, and then there was a big smart city conference in Denver about a month ago, and I just watched the tweets and occasionally found a couple of articles by the keynote speakers. But yeah, there was the idea of citizen participation. In fact, the name of this event, the last 2 words of the event description was participatory design. Okay, and which is a big topic in healthcare, getting patients more involved and doctors more involved in the design of the systems as opposed to designing for them, foisting it on them. And
I was looking more like Los Angeles area. What they basically did was they were setting up these committees that took it out of the electorate. It took it out of the democratic process. That these committees were in charge of large areas of Los Angeles, where sometimes the actual voters couldn't even vote for the people on the committee that were making rules for their areas. You can look more. There's one guy out of Los Angeles called Grindall 61. Out there in Los Angeles, kind of fighting against many of these non-democratic means of imposing this kind of stuff. And it's becoming very, in some areas, because of the citizenry not necessarily agreeing with the direction they're going with, moving away from cars and trying to push people towards bicycles and pushing people into more housing. That's like a lot of cities are now pushing people out of houses and pushing them more into more compact cities where you have more apartments rather than houses. And there's kind of a pushback in many of those cities to this move, and especially when it's not necessarily democratic.
Yep.
That's a great point. And
okay, guess what? I have a pretty hard and fast rule that I end this pretty close on the dot. People are welcome to stay, but I want to, when you know, if you come to these in the future, you're not going to end up here for 3 hours and I have to ghost me, you know. But what I want to do is, Dalton, I'd like you to complete your thought and include a little bit of a synthesis and summary for us of kind of the last hour. Go ahead.
Fantastic. So we talked about, started kind of talking technology and then got it more towards the personal side of it. I like the way we ended it thinking about the citizens. I'd like to end my thing because we kind of started talking about social determinants of health. And outside of the government, even, it's just hospitals saying, we think this is the right thing for the community. One of the things I've been trying to do lately is help push a House Resolution 660 that actually puts the opportunity to make money back in the community's hands. So if people on Medicaid in the community can get healthier and save costs, they get to choose how that money is going to be used in their community to help perpetuate those that health growth and improve their lives.
Well, super. At this point, I want to plug the health systems chat. It's on AltSpace VR, and right now we have 4 upcoming events, and the events are all listed right up here. So in a couple of weeks is the big Maker Fair, which is all about do-it-yourself creating and solutions. And there's a giant 3D printer, and that's me. So it's a 5-story 3D. So here we have a little city, and here we have a giant printer. And then in a month is Augmented World Expo. It is the largest virtual reality conference in the world. And we're going to be, and that little beer truck park is going to be parked in front of the center, the convention center in Santa Clara, where the conference is going on. And then in 6 weeks, we're going to be floating over Helsinki, Finland, discussing health IT. And look, integrating health and social care, healing and aging in place, social, ethical, actionable data, innovation, AI. We're going to see a lot of the same themes come up as that we've talked about here. And then finally, we have more planned, but this one is about sensors and detectors. Well, if you think about it, I'm moving my hand by moving my controller. And so there are sensors and detectors in my controller as well as in my headset. And those are really interesting little bits of technology. So you don't have to be an engineer to understand what's going on, but I think that's going to be a good one. So I hope that you'll subscribe to the Health Systems Chat, and you are welcome to stay and chat among yourselves or read further, but my headset power is low, and so I'm out of here. Yeah. Hope to see you again. Thank you, Dalton, and thank you, M. Sharmas on Twitter. And ClickDork, by the way, is KLIQKDORKU. And when I'm gone, I hope you'll introduce you to each other if you're on Twitter. And I'm Guy. Bye-bye.
Bye, Doc.
Have a great day, everyone.